Iboga has serious health risk and contraindications. There's very little research on the effects of Iboga when you're microdosing. However, the research into using Iboga and Ibogaine at high levels, under flood dose levels, contraindicate anybody with psychiatric disorders, cardiac conditions, especially those that are QT prolonging. Anyone using antidepressants or SSRI should be extremely careful. And anyone who's on any kind of drug replacement therapy drugs, such as methadone or Suboxone, should be very careful when using Iboga or Ibogaine. There's a long list of contraindications and health risks, so if anyone's going to engage with this medicine, I recommend doing your research and not just listening to me. I'm not a medical professional. Personally, I was medically cleared for a full flood dose before I started working with this medicine. I'll explain more about that. So what is Iboga? If you ask me, I tell you it's a powerful entheogen that's helped me identify the cause of triggers, blocks, trauma in my past and deal with them effectively. If you were to ask someone like Tricia Eastman, who's a psychedelic philosopher and writer, someone who conducts legal Iboga retreats outside the United States, she might tell you what she wrote on entheonation.com. That is, Iboga is the vehicle that allows you to sit with yourself long enough to realize that thing you're afraid of is an illusion. It's my absolute favorite description of Iboga. If you were asked a botanist, he'd probably tell you that Tabernacle Iboga is a perennial rainforest shrub native to West Africa, areas of Cameroon, Republic of Congo, Gabon. If he dug a little bit deeper, that scientist might be able to tell you that the inner root bark of that plant contains 12 different alkaloids, including Ibogaine, which is its active alkaloid. It's a powerful psychoactive tryptamine that produces what's been called a waking dream state. That answers the question that comes up a lot: what's the difference between Iboga and Ibogaine? Iboga is the inner root bark of the Tabernacle Iboga bush. Ibogaine is that plant's active alkaloid, isolated and extracted from the plant. When you hear about addiction interruption, and I'll talk about that in a second, you usually hear people talking about Ibogaine. There are a couple reasons for that. First one is that from one plant to another, the concentration of Ibogaine is hard to determine, but it's usually somewhere like 4 to 12%. So if you want a high dose, you'd have to take a lot of basically wood into your stomach. It's very rough on your system. It also makes it very hard for people in the clinical setting to dose effectively and consistently. So they tend to use Ibogaine, HCl, hydrochloride, which is somewhere around 99% pure consistently. I want to talk about dosage too, because I'm going to be talking about dosages, and please don't listen to my dosages. 100 milligrams to me might affect Shuri very differently and affect you even differently. So please do your own research and figure out what works for you. But the dosages I'm going to be talking about refer to root bark, which, as I say, is something like 4 to 12% Ibogaine content. Ibogaine HCl, TA, TPA, different tinctures and things like that, all have different concentrations of Ibogaine. So please be careful if you're dealing with something other than Iboga root bark. There is a lot of information online about using Iboga as an addiction interrupter. I won't be talking about that tonight. I'll be talking about psychospiritual uses for Iboga. But I will tell you the history of how that came about in the United States. In 1962, Howard Lotsoff was a 19-year-old heroin addict who lived in San Francisco. He was having dinner with a chemist friend one night. And he gave him a vial with some white powder and said, "This is Ibogaine. It's a really strong psychedelic and it lasts about 24 hours. That was all he needed to hear, because he did it right after that. 36 hours later, after he peeled himself off the mattress he'd been on the previous time, he went outside, looked at a tree, and realized 3 things. He was no longer afraid of dying. He had no desire to do heroin for the first time in many years. And even though it had been almost 2 days since he had fixed, he had absolutely no withdrawal symptoms. Howard Lotsoff began treating his friends and other people in underground situations because, unfortunately, in 1967, the United States government made Ibogaine a Schedule I substance along with Iboga. But Howard Lotsoff was responsible for writing scientific papers, even though he had no advanced degree, for setting up clinics around the world and helping tens of thousands of people get off opiates and heroin. So how was Iboga discovered? Legend has it that a Babongo or Pygmy chief trapped a porcupine one day and brought it home for dinner. His wife ate the porcupine and had an intense psychospiritual journey where her true spiritual nature was revealed to her. It lasted more than 24 hours. She told her husband about it and he wanted to find out what happened, so he went back to where they had trapped the porcupine. Found it had been eating the root of a particular bush. He took some of that root back and shared it with the tribe. Legend has it that the entire tribe received profound healing, that the spirit of the medicine told them what plants from the jungle to use to treat certain diseases and cure parasites. They eventually shared that knowledge with other Bwiti people. Bwiti, spelled B-W-I-T-I, is often referred to as though it is a tribe or a race of people. Bwiti is actually a spiritual discipline practiced by over 300,000 people in West Africa, and it's actually one of the 3 officially recognized religions in West Africa. Bwiti people have heavy elements of ancestor worship, animism, and Christianity in their religion, even though the tenets of that religion vary widely even within certain tribes. But among those who believe in heavy elements of Christianity, there are many who believe that Iboga is the original tree of knowledge referenced in the Bible. Bwiti people use Iboga for rites of passage, for initiation ceremonies that last many days, for deep healing for physical and psychological ailments. And they also use it as a sort of a pick-me-up like we do coffee, chewing a little bit of root bark now and then. So Iboga came into my consciousness a few years ago when a friend of mine told me he had done it. He said that he closed his eyes about an hour after he did the medicine, and his third eye opened, and he could see movement within the room. His own hands, people walking around, but he was able to close that eye and just go inside. He was an avid reader, and he described seeing a large book on a bookstand and 6 small angels sitting perched atop the book, singing some tune that I can't remember to this day. But he said he would ask questions about his life. Why do I think this way? Why do I have this opinion? Why do I have this habit? When that happened, the book would flip pages to the parts of his life and show him what caused him to have these beliefs about himself, what caused him to have these triggers, what caused him to be traumatized, that he had to certainly protect himself. Another guy I know who was a movie buff described being in this large theater all by himself in the center seat and having a split screen. On one side were things that happened to him when he was small, on this side were things that he was doing in his adult life caused by that. He could even rewind it and watch exactly when it happened and how it affected him. He could mix up the two and see if there were layering sometimes. There were several things that happened that caused this behavior, or this certain thing that happened to him caused multiple behaviors. He sat with that for hours. So when he got done, he immediately went to his therapist and started talking to her and worked out several issues that he'd been working on for years. So I read Elizabeth Bass' book, Heart Medicine, True Love Story. And she told the story of the shaman telling her to go back to the room that she was in when she was 8 months old. She was immediately transported there, saw herself in a crib crying, and she knew why she was crying. She thought that her mother had deserted her. Her mother was actually at work. She also thought that her father didn't care about her. Her father was sleeping in the other room. The shaman whispered in her ear of the location she was actually in, "Go and pick yourself up." And she went and picked up her 8-month-old self and held herself in her arms and comforted herself. Said she immediately felt relief. Understood that it wasn't that she wasn't enough, but that her father just wasn't enough at that time. Gained a great deal of compassion for him. When I read that passage, and I went back and reread it 2 or 3 times, I knew I wanted to work with Iboga. So after doing all this other research, I contacted a facility in Central America that I had good references on. They had a long conversation with me talking about my psychological history, my medical history, different things in my past, and told me I had to get an EKG and some blood tests. So I headed out to get those tests done. I was very excited. Started making travel plans and checking airfares and things like that. We'll come back to what happened. So generally when you hear about Iboga being used, you hear about a flood dose. That's doing something like 20 to 30 grams of root bark, basically eating tree bark to your stomach. It's pretty rough. It catalyzes an altered state of consciousness that's been known as a waking dream state. It has a few different stages. In those stages, past experiences, even traumatic ones that you haven't been able to deal with, are viewed from a detached state, which is why it's very effective for people who have things like PTSD. They can view the experience without being re-traumatized. Your brain is in a highly neuroplastic state following an Iboga flood dose. We'll talk about why that is afterwards too, but that's what makes lasting changes possible in your life after this experience. So the first 4 to 8 hours of the Iboga flood dose are what is called a waking dream state. Heavy ataxia and body load. Most people can't move much, and sometimes even the slightest movement causes nausea or purging. A lot of people need help with any kind of movement at all, sitting up, going to the bathroom, and so forth. There are highly personalized visions that may be very metaphorical, maybe very archetypal, maybe very direct. People report seeing repressed memories that they've completely forgotten about. But 4 to 8 hours after this phase, we go into what's called the reflective phase. During this time, people are very still have a hard time moving, and sometimes some of those visions become clear. It's clear what the vision meant and how it connected to destructive behaviors, habits, even addictions. Somewhere in the next 24 to 72 hours after that, people become able to move themselves, the ataxia reduces, their appetites start to return to normal. A lot of people don't eat, or they barely eat for 2 or 3 days after an Iboga or Ibogaine experience. The high level of neuroplasticity that your brain is in after is due to the fact that Ibogaine causes an increase in something called GDNF, glial cell line-derived neurotrophic factor. That is a growth hormone that promotes neuroplasticity and neurological regeneration. And I think that bears repeating. Ibogaine causes an increase in a growth hormone that promotes neuroplasticity and neurological regeneration. There's research being done right now into the possible use of Ibogaine as a treatment for Parkinson's disease because of this. So I decided I wanted to do a blood dose. Contacted the facility. They sent me for my blood test. I got a message saying call us as soon as possible. I thought, great, I'm going to find out when I can go have this experience. They said, I'm sorry, but we can't work with you. I take a medication to control seizures. It's called Dilantin. It has to be maintained at a certain level in my blood. If it's not, I'm in danger of having a seizure. Because of the way that Iboga works, it basically wipes those substances out of your system and cleans the receptors. So I would effectively have no Dilantin in my system, at which time I'd be in danger of having a seizure and not be able to metabolize medication again. So understandably, providers wouldn't work with me. To say that I was disappointed would be an understatement. I felt strongly called to this medicine. So I started thinking about possibly microdosing. I remember being at an event here in Los Angeles, a psychedelic community event, and meeting Elizabeth Bass, who had written a book that I read. She had the vision of picking herself up at 8 months old and asking her about microdosing. And I'll never forget what she said to me. She said, the fact that you're thinking about working with the medicine right now means that you're already working with it. That really stuck with me. So probably 2 months later, I got some Iboga root bark capsules, and I took a 300 milligram root bark capsule. About 3 hours later, I had to drive to Orange County. It was a 2-hour drive. An hour into that drive, I realized I was sitting stopped in traffic, and I really didn't care. In fact, I was kind of having a good time. I thought, wow, this really works. Now, I will tell you that microdosing, as far as Iboga and Ibogaine are concerned, is all over the map. When you talk about psychedelics and microdosing, you generally talk about a subtherapeutic dose. You don't do enough mushrooms so that you're half tripping and go out into the world. You take enough so you really don't feel the effects. Well, with Iboga and Ibogaine, people are taking 300 milligrams and 500 and enough Ibogaine that they can't function and they have to lay down. So microdosing is all over the map for Iboga. I decided to try 300 milligrams. I knew that I felt the effects. I knew it wasn't really microdosing per se, but I couldn't find a consistent protocol anywhere. Someone just said, take these 300 milligram capsules every day until you start feeling something. Well, the second day I felt it a little bit more, and I was a little bit more aware of what was happening to me. It was still just a real chill pill. It was kind of a stimulant. I was having a little bit of trouble sleeping, but when I did, I had very powerful dreams and I could remember them, which I usually don't. Third day, I felt about the same. The fourth day, I felt like I got out of bed and stubbed my toe and hit my head and then jumped into a pool and started moving because I had brain fog. My body didn't want to move. I was extremely tired. I knew the medicine was building up too much in my system. So I decided to back off for a while. And I took 5 days off. Then I took a 300 milligram capsule about 11 o'clock in the afternoon. It was a Friday, and about 5:30, for some reason, I took another 150 milligrams. I just wanted to push it and see what I would feel if I took more. And then I realized it's about 6 o'clock at night now, and I'm kind of amped up now. I probably won't be able to sleep. Now, I smoked cannabis probably 2-3 times a month at the time. I hadn't smoked any for probably a couple of weeks. I thought I'll smoke some cannabis and lay down, that'll help. So I smoked a little cannabis, I laid down, and put on some wheaty music. Now, wheaty music is to Iboga as Icaros are to ayahuasca. It's polyrhythmic, meaning it has more than one rhythm. Sometimes it contains binaural beats. It has some very strange effects. It's got the effect of keeping your conscious mind sort of distracted. When you go over here and work with your subconscious, and I'll tell you about that happening to me. It also has the effect of sometimes clearing out noise. I had a very intense experience one time where I had so much going on in my head from these 2 medicines that I couldn't think straight. For some reason, I put on the music, and it seemed to clear off this layer of noise and get to where I was thinking, allow me to think more clearly. So it's got a very interesting effect, and I thought I would play some for you because if you think that wheaty music is like Icaros, which is what I thought it was probably like when I first heard about it, you're probably mistaken. This is an hour long. I'm going to play a little and jump around a little and give you an idea of what it sounds like. Saying, do as you want. I'm going to close your eyes and see if you can feel this. Fast forward a little. Anyone feel a little agitated from that?
Yes. Where's the bucket?
So that's what happened to me. I smoked some cannabis, put on this music, and the first thing I was thinking was, this music is making me kind of agitated. It's not really relaxing, but for some reason it was really compelling, and I left it on. And after a while, the music kind of disappeared, and I realized it hadn't so much disappeared as I had this distinct sense that I was busy over here listening to the music, but I had slipped out the back door to start working with myself while I was distracted. I don't usually think of things in a graphic fashion, but for some reason I started to think of something someone had said to me a few days earlier, which I viewed to be critical of me. And I saw it in this fashion. I saw this straight line of that person, what they said, and how I received it. And I just thought, there's got to be more to it than that. And as soon as I thought that, the line backed up, turned on its axis, and suddenly I could see that person's history, their opinion of me, their intention when they said it, what they said, the validity or lack thereof, my own history and triggers, opinion of that person, willingness to hear it, and I started multidimensionally analyzing this thing like, well, if they had a good intention, even if that's not valid, perhaps they were trying to help me. And at one point, I even turned it around and saw it from the other person's point of view and thought, yeah, they had a point. That's not what I usually do in those situations. I went through this whole thing of realizing that criticism was this great gift that I had because other people would call me on my BS when I wouldn't do it myself. That's not usually how I think about those things. I started thinking again, and I actually was asking questions at this point. I said, why do I have this particular opinion of myself? It immediately showed me because this happened when you were a child. I thought, that's right, I forgot about that. I said, then these 3 things happened to reinforce that. I said, yeah, that makes sense. And the medicine said, yeah, that makes sense, but you're ignoring these hundreds of things that happened that invalidated that because you bought into this already. And I sat back and looked at it, and I didn't see a balance scale, but I saw those 2 things fall, and when they hit the ground, this so far outweighed the negative opinion that it shot up into space, and I immediately felt that opinion of myself lift off of me. And there's still a trace of it, but a lot of it disappeared at that very moment. I've had a lot of experiences like that using this combination of medicine. That's the kind of thing that can happen. I wanted to tell you about some other people's experiences. One person described using this combination of medicine as a sort of a psychoanalytical playground. So he looked at different behaviors, habits that no longer served him, he could swipe them off like he was working with a touch screen. And then walked around looking at behaviors that didn't serve him anymore and getting rid of those. This is why some people refer to this experience as a defrag. Get rid of things and compact it so it works more efficiently. One woman had recently lost a pet. She sat back and thought about how she was grieving for that pet, and then decided that she was just going to let the medicine take over. And it adjusted her body, and then had her start breathing differently. She took a deep breath and let out 3 long exhalations, which she described as clouds of grief coming out of her. After the 3rd one, she felt the grief had lifted off of her. She was better able to deal with the situation. Another woman had a job offer to take a job that was more in line with her beliefs, but paid a lot less than she was used to. She just decided that it wasn't time for that. She'd have to make a lot of sacrifices. She was someone who prided herself on never letting other people's opinions of her influence her decisions in life. So she did this combination. She smoked a little cannabis. She had an intention of something she wanted to think about and work on. But she couldn't stop thinking about that decision. And suddenly she saw when she was 4 or 5 years old, her mother getting her and her siblings ready for church. She had decided that she wanted to wear overalls to church. Of course, some said her mother wanted her to wear a nice dress. And they were fighting about it, and she was crying. She distinctly remembered her mother saying, "Honey, how would that look if you're wearing overalls? You're going to walk into church and all the girls are going to be wearing pretty dresses and everyone's going to be looking at you wearing overalls." And in that moment, she realized how profoundly that had affected her and how it affected almost every major decision she made in her life. And then decided at that moment she was going to take the other job. Difference between a flood dose and a microflood dose. Well, the ataxia is almost non-existent. There is a point, especially in what's called phase 2, and I'll describe what that is shortly, where it gets a little bit harder to move, but you can get up and move around. It's not like doing a flood dose. There's certainly not the nausea or purging. In fact, you can't eat. In fact, if you do eat, whatever you're eating is probably going to be the most delicious whatever that is you've had in a long time. So I recommend trying it. Duration is only 4 to 6 hours. Afterwards, you have some fatigue. It's been hard for me to pin down whether that's just a cannabis hangover for me. I mean, I know Iboga is hard on your body, so there is some fatigue and there's some body load from it. But for a day or two after, you'll feel the effects. You just feel a little bit tired, a little bit of tiredness. You have to be gentle with yourself. But definitely a shorter duration. The images that you get, especially during the first phase, like I say, are what I've been describing here. They're much more direct. They're not so symbolic, archetypal, not so confusing. A friend of mine, and I can't remember who to this day, I thought it was Ben, and he said it wasn't him, said you might ask ayahuasca what's the meaning of life, and it will show you a goat. Then it's up to you to figure out, is my life the goat? Am I the goat? Are you the goat? And you have to figure it out from there. So it's not going to give you a very direct answer sometimes. It can be tricky like that. You'll get some direct answers with this medicine, at least during phase 1. So I have a protocol I've developed for this. If you'd like to reach out to me, if anyone's interested in trying this where it's legal to do so, I can help you with that. But I can tell you initially how you would do a micro-flood dose, is what I'm describing. First, I would expect that you would do your research, look at health risks, contraindications, talk to providers if you have to. Ideally, get medically cleared to work with Iboga at a high level before you work with it at this level. Like I said, it's serious medicine with some serious health risks involved. When you're going to microdose, I'd recommend starting off very small. You know, in indigenous cultures where they work with plants that they've never used before and they're trying to figure out if you can even use them, they'll first take a little bit and put it on their skin. If nothing happens, they'll put a little bit more on there, eventually put a little bit on their tongue, and slowly but surely build up their dose to ensure they're sure it's something they can consume. I recommend starting off with something like 25 to 35 milligrams just to see if the medicine agrees with you. Maybe there's some allergic reaction, but start off very small. You can take off a few days in between and build yourself up to where you get to, 150 milligrams maybe. At some point, I'd recommend working with the dose you're planning on microflood dosing with. For me, that was 300 to 450 milligrams. it might be less for you, but pay attention to your mood, to your energy levels and things like that while you're microdosing. And if it gets to where you do feel fatigue, if it gets to where you do feel brain fog, you should probably back off and wait a few days. You're going to know that's kind of your limit. I recommend before you start micro-flooding that you don't have cannabis or Iboga in your system. I would think of some questions that I want asked so that they're in your consciousness. Like, why do I think this? When did I start thinking this? What if I started doing or thinking this? Think of things that you would like someone to ask. Get that into your consciousness. That's the idea of it. Take a break from both cannabis and Iboga, and on the day of, I would have a darkened, quiet space ready where you can lay down and not be disturbed. Iboga is something that's heart opening. It is fun to have activities. It is fun to interact with people, but this is also a very solitary experience at first. I would plan on doing it by myself, except for having a sitter handy the first time that you work with it. Like I said, it's serious medicine. You're not going to do a large dose, but it's not going to hurt to have someone else in the other room just in case you need some help or you need somebody around. So I definitely recommend having a sitter. Have music ready to play. Ouija music is highly recommended. Like I said, it's engineered to work with this medicine. Stick with it and see where it takes you. After a while, you can try things like binaural beats or solfeggio tones. Those are also really effective, very interesting, as in just music that you like. I would have a pen or paper to write. You know, I wrote or some kind of recorder, but I prefer writing because sometimes realizations and insights will come very quickly on this medicine, and you might, I've had the experience of thinking, oh my God, I won't forget that as long as what the hell was I just thinking? So I would have a pen and paper handy and write things down as soon as they come to you. I've also had the experience, the reason I say not a recorder is I've had the experience of thinking about something, starting to write it, actually forgetting what it was until I'm done writing. And I've sat there writing and not knowing what I was writing until I was done writing on this medicine before. Have cannabis ready to smoke. Have water and or some kind of hydration handy. Set an intention. Go big with your intention. And when you're ready, place a small amount of medicine on your tongue. Let it roll under your tongue. Your mouth will numb after a while. It just does that. It will taste kind of like wood because it's wood. So it's not the greatest tasting thing in the world, but when you know what it's for, it has a beautiful flavor to it. So commune with the medicine for a while. State your intention out loud so that you are both speaking and listening at the same time. So that you know this is what you are saying and what you are hearing. That's very important. Then take the balance of the medicine. The dose is up to you, but I would start smaller, something like 200 to 300 milligrams. But like I say, you're going to know your tolerance by that time. When you start to feel the effects, which is about 30 minutes or so, you feel a little bit of stimulant effect. I would go to a mirror, look yourself in the eye, and you'll know if you feel this medicine when you look yourself in the eye in the mirror. You know, looking in a mirror on psychedelics is not always a great idea, but on Iboga, it's actually a very powerful experience. So look yourself in the eye and state your intention out loud. Mean it. Then give the medicine permission to heal you. And I look right at myself in the eye and say, I give this medicine permission to heal me. Go to your quiet place. Read over the questions that you've written down earlier in the week. That's going to help prime your mind. Then smoke a little bit of cannabis. And I mean like a hit or two, because you can overshoot this thing very easily. So smoke a little bit of cannabis, lay back, cover your eyes, start the music. You can think about your intention and your questions, but sometimes the medicine will just charge right in and tell you what to think about. This is the only psychedelic I've worked with where set is not as important as it is with other psychedelics. I can remember doing this one afternoon and thinking I was agitated about something, and this is probably not the best time to do that. And as soon as the medicine started taking effect, it showed me why I was agitated and what I needed to do about it. So it cleared that away for me. It wasn't an obstacle, it was actually something I got to work on immediately. You're going to know if you're in a productive space very soon. You'll know because you'll start thinking about things in a certain way and start noticing things. And things will pop out at you. And you'll think about things in a way that you never have. Try not to get disturbed or distracted by visual phenomenon. If you do, you can open your eyes and the visual phenomenon will stop. No matter how powerful the visions are with Iboga, if you open your eyes, they stop immediately. Even on a flood dose, you might see some tracers in it, but visions aren't there once you open your eyes. And be careful when you're standing or walking. Some of the productive things you can do on this medicine, at least in phase 1, are find the thoughts and or emotions in your body related to a certain incident. You can tell yourself to let go of the anxiety you feel around something. You can actually feel into that and tell yourself that you don't have to feel it and to let it go. You can feel trauma leaving your body sometimes. You can feel shivering. You can feel where it is in your body, like a specific place in your body. You can tell yourself to let it go. Give yourself permission to do that. You can ask it to show you where a particular physical or mental discomfort originates. Sometimes you're going to find out that this pain you get in your head over here really starts in your shoulder over here. It'll actually show that to you. You can ask it why you think or feel a certain way about something. Sometimes it'll take you back to the origin. Sometimes it'll step you back one thing at a time. You can remember an incident that causes you fear or anxiety and watch it as though it were a movie. You're in a movie theater, large theater, in the middle seat, all by yourself, and you're just watching a movie, trying to figure out what you can about it, from everyone's point of view, not just yours. Once again, talking to yourself in the mirror, once this medicine is very strongly upon you, I highly recommend doing that. You actually feel like you're talking to your subconscious or your soul. It's a very strong experience. As far as integration, once you've completed your journey, try to stay quiet and avoid distractions. Remember, your brain's in a highly neuroplastic state. So you want to reflect on what you learned, what kind of changes, if any, you're going to make in your life as a result. Since your brain is essentially waiting for you to show it what your life is going to look like because it's in this neuroplastic state, going back to whatever you're doing before, doing things mindlessly and not in a mindful way, just send a signal to your brain saying, oh, okay, we're still doing this, that's fine. Try to get into nature, try to do something different, and if nothing else, do things differently. Brush your teeth with your non-dominant hand. Move the trash can. Take a different route if you have to drive somewhere, but don't do things mindlessly. Try to be mindful of everything you do. If you put on a sock and a shoe and a sock and a shoe, put on a sock and a sock and a shoe and a shoe. Just change things up to show your brain and your mind that things are different now. If there are any habits that you want to change, if there are any serious changes that you want to make in your life, now would be the time to make those changes, to mindfully figure out exactly how you're going to do that, how you're going to implement those changes in your life. And it's going to be uncomfortable, as change always is, but it would be a good time to do it. Your body is going to have Ibogaine in it, your mind's going to be in a highly neuroplastic state, and highly open to suggestion. I say try to eat well, that's not because it's required, but really if you're going to clean up your diet and your body's and your mind's in a state where it says, show me what we're going to do now, why not do it at that time? Practices like yoga or meditation help to ground you. Any kind of body work or energy is really beneficial. I've had a massage the day after and it feels great. I recommend if you do any kind of energy work, body work, anything somatic, that when you feel the sensation of hands on you or energy running through you, imagine you're getting deeper into your body. Embodiment is something I've got a lot of working with this medicine. So feel yourself being pulled further into your body, more secure in it, more grounded in your body. Reviewing your notes is a good idea. Anything that you wrote down, review it as soon as possible and try to remember how you felt when you wrote it. Try to remember the state you were in at the time. Review them repeatedly. There's a lot of information in there that I can tell when I'm writing these things during the experience that this is something I want myself to know. And I've even written that down to myself. You have to realize this. You need to read this later. This is very important. So it isn't in a way like your subconscious talking to you, trying to help you. So try to review your notes. Reading, watching, or listening to anything educational, inspiring is great in the afterglow. It really reaches deep down into you. I just want to say too that if you've had the experience that after using psychedelics, the cannabis is more psychedelic, it's the same with Iboga. It's much more introspective, It's a much deeper experience. So if you do smoke cannabis after this, you might want to be mindful of that and take it slow at first. So I do want you to remember again, if there's any habit, behavior, or anything else that you want to change in your life, immediately following this experience is a good time to do that. Remember, your mind is waiting for you to show it what your new life is going to look like. With that, I'll say thank you and ask if there are any questions.
The medical stuff. If an individual has a clean bill of health, like no medications, blood work, everything is normal, sugar, cholesterol, would that individual be like good to go essentially, or like?
I can't answer that question. I can tell you that cardiac abnormalities, especially those that are QT prolonging,
What does that mean?
QT prolonging. I'm not even going to try to explain that. It has to do with the interval of your heartbeat. That's what they check for in the EKG. That's one thing that will immediately put you out of being able to work with Iboga or Ibogaine. And
So,
there are a list of. I would look it up online. Please don't listen to me.
oh gosh, so in other words, so the research would be online, but
There are a ton of forums. There is Iboga.com, and there on Reddit you can find forums. You can find a lot of places that tell you all the health risks and contraindications.
okay,
There's a
so
lot of
basically you just have to compile, because if you go to your doctor, you can't really tell them I'm going to work.
When I went to my doctor to get the EKG and blood test, I told him I was running a marathon.
Okay.
Now, I didn't know he was a marathoner. The only thing I know about marathons is they're 26.2 miles. So I started asking him my nutritional routine and my training, and I knew nothing. So he knew something was up, he just didn't know what. You can also talk to providers and ask them, what are the health conditions that I need to meet?
Okay.
What are your criteria for working with someone? What kind of tests do you do?
Oh, good. Okay. Cool.
But you definitely need an EKG,
Okay.
and a lot require blood tests. Yes, sir.
If I followed you right, this suggestion was that you'd be smoking the marijuana about 35 minutes after you ingest the full dose.
Yeah.
Uh-huh.
Have you done MDMA or ecstasy?
Yeah.
Okay, so there is that feeling like I need to be doing something. When you get up and start dancing, you feel normal.
Mm-hmm.
It's kind of that feeling, like
Okay.
I should probably be moving or doing something, or just a little bit. It's a little bit of a stimulant. That's what you'll feel when it starts to take effect. But you know when it starts to take
Mm-hmm.
effect. It's generally about 30 minutes, or 30, 40 minutes should be reliable.
Did you say that you've done a full flood dose as well?
I have not.
You
I
have
can't
not.
do a flood dose because of the medication I take.
And have you compared the root bark with Ibogaine?
I have only worked with root bark and once with TA. That is total alkaloid. That's an extraction that has all of the 12 or 14, depending on who you ask, alkaloids that are in Iboga in an extraction. I didn't notice a lot of difference between that, but I'm sorry, you were asking also the difference between those. I don't know about Ibogaine.
Yes,
I
I've
prefer
been
working
on-
with the whole plant whenever I can.
Yeah.
Because we don't know what we don't know, and there are a lot of theories about what some of those other alkaloids do and how they potentiate each other and how they work with Ibogaine. So I just prefer to work with the whole plant.
Yeah, I've done some research, and it appears that the plant is being threatened, and so I'm personally concerned about that. And I know you can get Ibogaine that's derived from a Voacanga, a different plant,
Right.
so it doesn't threaten the Bwiti practitioners with their ceremonies. And but I haven't been able to find credible descriptions of the distinction between what one experiences on Ibogaine versus TA or the root bark.
I've read accounts from people who've done all three.
Uh-huh.
Iboga, root bark, Ibogaine, and TA. And this person said that the TA actually felt a bit cleaner, but otherwise there wasn't a huge difference between them, except for the body load from the root bark.
Between all three.
Between all three. Because of course, with the root bark, like I said, you're eating 20 to 30 grams of root bark. So
Right.
it's kind of hard on your system, especially when you purge.
Yeah, your BMs are going to be regular.
Yeah, exactly.
Thank you.
Sure. Yes, sir.
What type of cannabis, sativa or indica, do you recommend?
I've talked to people who work with both. I prefer to work with sativa most of the time when I smoke, just because otherwise I'll be if I work with indica, I'll be in couch lock. I'll be on the couch watching some TV rerun and eating Doritos. Yeah. So sativa is a little bit easier for me, but I have worked with indica as well. I don't think there's that much of a difference. I just think it has to do with the THC content. And I will say also, one thing I didn't cover is that this is something that only works with smoked or vaporized cannabis. I had people that tried it with edibles, with oils. Consuming cannabis with Iboga is not the same thing as smoking or vaporizing cannabis. It has to do with the delivery system. It has to do with the immediacy. It's hard to dose and it's hard to time these things. So, when you start feeling the Iboga, you can immediately smoke something and feel the effects and sort of titrate it, figure out where Ibogaine is. You eat edibles and 2 hours later or 30 minutes later, it starts to come on and it's way stronger than you thought it was. It just doesn't work the same way. And also I know that through edibles, it metabolize something like THC-11 or something that's sort of different compound that makes you more high, but it's more of a body high than a head high. This is definitely something where you want the head high. Yes?
When you smoke, are there certain indicators that you're paying attention to determine kind of your THC level? Because you mentioned, like, if it gets too intense, you can eat certain things to
Yeah, mostly just going slow at first. I think if you just have, for instance, I don't smoke that much. I smoke a few times a month, and if I take 1 or 2 hits of cannabis and sit back, I usually find that's enough to get me started. Now, any time along the way, 5 minutes in, 15, 30 minutes in, you can take a little bit more if you'd like to. But you can, like I say, overshoot it, and it can be kind of intense and sort of hard to concentrate. So the first thing you want to do is just sort of kick the Iboga in the butt and potentiate it so you feel the effects that you would feel if you had taken more. That's what this tends to do. It's not so much about having a cannabis high, it's about potentiating the Iboga. So usually with a very small amount at first, you can close your eyes and you can tell that that's happened. You know the difference between 5 minutes ago when you can feel the Iboga and now, because now your mind starts racing and you start looking into things and you're kind of like, holy crap, what's happening? But you'll know when it gets productive.
So if you're on the timeline that you outlined and you're in the peak, and you're finding that maybe you're not getting the visions or something, or the thoughts aren't really gelling, then smoke a little bit more.
Yeah, and the same thing goes for if you decide that you're hungry or that you want to come down a little bit and you eat something, you come down a little bit, just smoke a little bit more, you'll go right back.
Cool.
Yes, ma'am.
2 questions. One, just to clarify, you were talking about specifically working with flour rather than oils.
Yes.
Right, even with vaporization. Okay. And then the other is what you were just talking about, like if you need to ground a little bit to eat something. Have you worked with CBD as another version of grounding?
You've worked with Danny, right?
Yeah.
What is that solution that you use, the CBD solution? Because it's not CBD oil. What is it?
It's it's by a company called Holos. It's a CBD sublingual liquid.
Right, I remember. So Daniel McQueen is a guy in Boulder, Colorado, with an organization called Medicinal Mindfulness.
Yeah.
And Sky has actually undergone training. Did sitter training?
Yeah.
He has conscious cannabis circles. It was actually one of the most powerful psychedelic experiences I've ever had, just smoking cannabis with this guy, listening to his playlist, and listening to him talk. But he has a sublingual CBD solution that's supposed to bring down the cannabis high pretty quickly.
It's like a nano CBD.
Yes.
Yeah.
Yes,
Okay.
it is.
Yeah, I have not used that, but yeah, that would probably be ideal. Thank you.
Couple of questions. How long does the journey last?
About 4 to 6 hours.
Wow.
So 2 hours in is when you start the Ibogaine peaks, and you're smoking, and sort of phase 2 after that. That can last an hour or two. The sort of afterglow from cannabis and having this in your body, you can find that you're laying there just having a great experience, and you're sort of back to baseline, but kind of depleted and thirsty and needing rest after about 6 hours. Usually 4 to 6 hours or so. So fairly short in duration.
Fairly shortened, but also can literally take most of the day.
Yeah, oh yeah.
Yeah, just wondering if there are any other pitfalls other than like taking a little too much that to look out for along the way.
Not that I've had, I would think that I think this with psychedelics in general. I think if there is something that you don't want to deal with, you should exercise caution, because I think this, like other psychedelics, I haven't had this experience, but I know I've had this experience with psychedelics in the past, that if there's something that you don't want to deal with, that's probably the first thing it's going to show you, very close up and right in your face, so that you can't get away from it. But I've always been an advocate of anyone having issues like that working with a psychotherapist anyway. It's been tremendously helpful to me.
And do you find that that's an important pairing too, to have these experiences on your own, but also seek integration coaching or psychotherapy?
Absolutely.
In
A combination of plant medicines, psychedelics, traditional psychotherapy, and coaching, which also included integration coaching, sometimes working directly with Cherie when I first got involved with this, have all been beneficial. But I think that three-legged stool of plant medicine, psychotherapy, and some sort of life coaching, spiritual coaching, integration coaching, whatever it is, whatever works for you, is a great combination. Yeah, having the experience and having a therapist who is open to, who was not trying to pathologize my use of psychedelics, to understand that I was using it for personal growth, and be able to talk about those things helped tremendously.
Thank you. That's a perfect conclusion for today.